see. Okay, so if I asked you what was the tissue type, you would say compact bone.
Compact bone.
The tissue type here is compact bone. That's what you find organized in this geometric way. Where in the structural unit, which fills most of the field, is called an osteon.
Okay.
So the structure that fills most of the field is an osteon. The tissue type is compact bone. If I point to one of these black spots here, that's a lacuna in which once lived an osteocyte. And the central part here is called the eversion canal. And
Calm
Yeah,
down.
that's true.
Calm
I
down.
want to see it to make sure it's in here.
which
You know what I'm saying?
once contained osteocytes, and these little lines in between them are the canaliculi.
So are you going to show it to
He's gonna point one and show it to the about the
Yeah, that would be a
cool.
hypothesis.
That's what he's gonna do.
So you can note that down. You see, when you come up to the microscope, notice which objective's in place. That will help to orient you as to the magnitude of what you're looking for. Okay. So that's a typical question, and you shouldn't get this wrong. Everybody should know that's compact bone. The tissue type is not ground.
Flying saucer.
The ground part has to do with how this slide is made because it's bone. So it's too hard to slice, so you have to saw a rather thick slice of it and then grind it down. And the bone powder fills the hollow places, and that's why they look black, because they're much denser.
So you know that they're full of bone powder.
Well, if you understand that, you don't have to remember that. I'm not going to ask you are they full of bone powder. I'm just
What are they
reminding you
full
of
of?
how the slide is made. Because also sometimes you'll find, depending on which ones I get, sometimes you'll find that the eversion canal is not black, it's white. And you'll say, oh, I was all confused. I thought the eversion canal was black. Well, black and white just is whether or not the powder is still packed in. Some of them look part white and part black, depending on whether some of the powder is fallen out. So that's a eversion canal, and it looks all white. That's a eversion canal, and it looks all black. It's just that the powder is still stuck in it, and so it looks black. But if you understand how the slide is made, you won't have to memorize the details. You understand it.
And then the little lines are what?
Those are the canaliculi, the little canals. Where the osteocytes are actually touching each other and connected to each other. They actually are exchanging cytoplasm through gap junctions. So that way they can efficiently... This cell, for example, that's about 4 lacunae away from the eversion canal can still get adequate glucose and oxygen because the blood vessels don't go any further than the eversion canal. This environment here within the matrix of the bone is so different from blood plasma that there's no blood plasma here. Okay. So that's a very nice, easy one. Everybody should get that one. By the time we're done with the rest of the day, I'll understand. Everybody should get it. And you really should.